Repro 363 block lecture. It's semester 6, year 3, academic year 2021. And this block book has already been posted in your Moodle, so you can look at it. So it is a 6-week block, which I tried to complete in 5.5 rather, to give you little time and so that you can be able to appear in the exam. The number of credit hour is 4. You know about it. I'm a block director, Dr. Brar. Dr. Hannah Abdullah is a co-director. Clinical director, Dr. Abdurrahman Al-Kabbani. We have, it's for endo. For clinical director for repro block is Dr. Wissam Kurdi. And we have year 3 director, Dr. Oban, and Muntasir is looking after his administrator. Regarding lectures are concerned, we have 2 anatomy lectures, 1 physiology. We have 19, both endo and repro pathology. We have 13 pharmacology lectures. We have 7 gynae, 9 clinical endocrinology lecture, 5 radiology, 4 microbiology, 1 immunology. Then we have CPC and LGD 8. We have 1 micro lab, which is on the 2nd week, and it's a total of 70 lectures and LGDs, including lab. Now here I should mention that we had kept 5 PBL, 5 for EndoRepro, but because of this change, I have reduced 1 PBL. So now it is only 4 PBLs with you, and how it is arranged, I will let you know. Regarding examination is concerned, are you able to see the screen? Huh?
Yes, doctor.
Okay. So we have continuous assessment for 5% for PBL, you all know, and final assessment is 95%. So we have written exam, multiple choice MCQs, multiple choice questions. We have 100 questions, which is about 70% of the total weightage, in which we have half of the endo and half of the repro one. So 100 is plus minus 100. It could be 102, 103, depends. Sometimes it could be little bit plus minus, right? We have 4 SAQs. Each SAQ contains 5 questions. So we have 20 SAQs questions. So it is 15% of it. And OSPI is, we have 10 questions, and each question carry 1 mark, so it is 10% of that. So it's a total of 95% of that. Okay. Now, general learning objectives. I'm not going to discuss all because it is already there in your block book. So we have endo separate and repro separate, and you can go through these all general learning objectives in your block book, and which is made very nicely. And here all the major general learning objective outcomes, how we are going to handle it, and how the examination is going to take place, how much questions we will be asked among these journal objectives. And this is for repro block, again the same one. How will we take it, the lecture, LGD, PBLs, whatever, and the MCQs and SCQs, which we will be going to take that. Now coming to the important point which you people are waiting actually, about the timetable, the schedule. So you have your exam now, GI exam, and the first week I have not changed anything because it's going all on smoothly, and I'll be having your lecture tomorrow. Dr. Atif will, after this one, Dr. Atif will come and review the female genital tract. So it has already, you people has already done that, but he will give you a review of that so that your knowledge will be refreshed. Tomorrow, my first lecture of pathology will be at 3 to 4, and the second lecture will be from 8 to 9. So now these are all online, right? On all online lectures. So you will take these lectures from your home or wherever. So then after that, Dr. Muna will take your repro clinical lectures. Then Dr. Mohabbat will be taking your microbiology lectures. Then Dr. Awartani, again a clinician, he will come and take your gynae lectures. Dr. Dilip will take the pharma, hormonal contraception, and then there will be one lecture of radiology by Dr. Jamal. On Wednesday, because it is booked already, the whole, only we have kept one lecture, which is of Dr. Mohabbat, one. And she might, because she was requesting me, so I have not put any lecture here. So she might extend her lecture a little bit more, right? So the SDL place, she can take that. Now on Thursday, again, we'll start with the PBL. So whatever PBL we have discussed first day, which is mostly genital infection. So you will be discussing this case on Thursday. And then after this PBL, we have a lecture of Dr. Mohabbat and physiology lecture of Dr. Ahad. And Dr. Ahad will be discussing the physiology of normal labor, because from next week, we will be discussing the labor and pregnancy things. So this is all about first week. Well, let's go on the second week. Now here the Dr. Awartani is going to discuss about the approach of the patient with menstrual disorders, which is related to the last week one. And then Dr. Imad will start with the cervical pathology. And then on Monday, we will uh, give you a new PBL, which will be regarding the pregnancy, right? This lecture, this PBL. But on Thursday, you can see there is no PBL on Thursday because there is IMF exam here, and we have to shift all your lectures of Thursday to afternoon. So I have requested all the clinicians to please cooperate with us, and they have accepted this thing, and I have shifted their lectures here, and the pharmacology lectures were transferred the next day. Now here, Dr. Imad will take your on Monday the pathology lecture of placental pathology and gestational trophoblastic disease. Dr. Wissam Kurdi, she is going to discuss about the antenatal, intranatal, and postpartal care of the patient. And then again, you have two radiology, and then we have microbiology lab. So all the microbiology which we have discussed in the first week, all the lectures of Dr. Mohabbat, and we by that end of this first week, you are having all the lectures of genital infections. So now we have kept a lab on Tuesday, and they will be discussing all regarding the uh, infection related thing in your lab. So vaginal discharge and lab approach. How will you approach the patient with that particular infections? They will tell you. On Wednesday, we have two consecutive lectures of Dr. Jamal, because Dr. Jamal is leaving for Pakistan. So he said, please kindly put my both of the lecture here so that I'll be free from the lectures. So I have kept it here. Then you have your exam of MIF, the first exam here. And because of this exam, we have shifted the PBL from here, and we have kept all these lecture which was in the morning to the afternoon, right? Okay, now this PBL, the second PBL, you are going to discuss on the second Monday, the other one, the third Monday. So on Sunday, we will be starting with the pharmacology online lectures, then immunology lecture, pathology. Dr. Imad will be discussing the uterine pathology. Dr. Sama Dr. Hatuf will be discussing about the drug used in pregnancy, and Dr. Sama will be discussing about the drug used in infertility. Then Dr. Dana, she will be discussing about the pharmacological management of the growth hormone disorders and hypo hyperprolactinemia.
Doctor,
Yeah, hold on, hold on.
the MIF exam is what? Is it a final exam?
Sorry.
That
MI,
MIF exam that you showed us in the
yes,
schedule.
MIF is a final exam, definitely, yes. Is your final MIF exam. And in the same, this is Thursday. On Saturday, you have a final pro exam, Pro 365, right? The same week on Saturday, you will be having a pro exam. Now here, sorry, there are two lectures which are actually Dr. Dana's lecture is number 2, which is drug used in induction of the control of the labor. So it is also related to the labor one. And then Dr. Sama lecture and Dr. Hatuf lecture is regarding the drug used in infertility. Now the 6th lecture, which is the Dr. Santosh, is regarding the growth hormone and hyperprolactinemia, which is on Wednesday. Yes. Now on Thursday, on Tuesday, I'll be giving a combined lecture on ovarian tumors. So I'll try to complete all the lesions of the ovary in these 2 lectures. If you want, I can shift one of the lecture on Monday afternoon or evening from 4 to 5, but I think it will be too late. This is a good time for that. You will be fresh and we'll start and we'll complete the whole topic here, right? Then we'll be having Dr. Muna's lecture. Dr. Muna is going to teach about the post-menopausal bleeding. And then Dr. Atif will be starting with the review of the anatomy of the breast. So it will be a review lecture for the breast. And then Dr. Imad is going to take both benign and malignant breast lesions on Tuesday. Then Dr. Noha's lecture, she is a clinician, and she will let you know about the approach of the patient with the lump breast. So your Tuesday will be a little busy one. Then on Wednesday, after family medicine, Dr. Kabbani, actually, uh, normally we used to keep pathology lecture before the clinical one, but as Dr. Kabbani was busy in the afternoon, so that's why I've kept his lecture in the morning regarding the pituitary hyper and hypopituitary activity, the clinical one. And then Dr. Imad is going to discuss about the pathology of the pituitary hyperfunction and tumor of the pituitary gland. And Dr. Santosh is going to discuss about the pharmacological management of the growth hormone and disorder of hyperprolactinemia. Then we have kept the first radiology lecture. It's what you call by Dr. Khalid. He will discuss about how this radiological images take place in the endocrine disorders. And then we will start with the new topic of thyroid, which is hypo and hyperthyroidism. And Dr. Nader is going to discuss about the thyroid function test here. And Dr. Kabbani, he will discuss about the LGD of pituitary gland here. After this Kabbani lectures, your pituitary will be over, and then we will carry on with the thyroid one. So here I just wanted to mention that the case which was on Monday, the 5th of April, regarding pregnancy, you will be discussing this case on Monday, the 12th of April, and on Thursday we will be giving you a new case. So this will be a new case, the third one, and you will discuss this new case on Monday, the 19th of April, right? Now, the thyroid lecture will be continued. I'll be taking this thyroid lecture here, 14th one, which is the tumor of the thyroid, and then parathyroid, hyper and hyperfunction of the parathyroid, and tumor of the parathyroid. And Dr. Nadir will be taking up the clinical manifestation and management of the parathyroid. Dr. Noha is going to discuss about the uh, investigation. Dr. Noha is going to discuss about the clinical and management of the benign and malignant thyroid neoplasm here. Okay. I think I should, yeah. Okay. So Dr. Khalid is going the radiology of the thyroid one, and the radiology, the nuclear medicine in the thyroid disorder, and Dr. Khalid will be doing it. And then we'll start with the diabetic one, diabetes. So my first lecture will be type 1 diabetes. My second lecture will be type 2 diabetes. And Dr. Nader will be with us discussing about the clinical aspect of the diabetes and complication of the diabetes. Side by side, Dr. Minal is going to discuss about the oral antidiabetic drug 1 and 2, and also the injectable antidiabetic drugs. Now coming to the last week, which is the 5th week, which I have helped you a lot to give you 2 extra days for your preparation of the exam. So the 4th case will be discussed here, 4th PBL case here. And Dr. Imad is going to discuss about the adrenal, disorder of the adrenal cortex and medulla. And the other lecture is on Monday, the adrenal tumors and multiple endocrine neoplasm. Dr. Kabbani will be starting with your adrenal clinical lectures of adrenal glands, and he will discuss the LGT of the adrenal gland on Tuesday. And finally, Dr. Samah will be taking your corticosteroid lecture, and Samah and Dr. Dana will be taking your corticosteroid and drug use in adrenal disorders. And finally, Dr. Dilip is taking your therapeutics lecture. So he will discuss the whole of the pharmacology and therapeutics of whatever has been taught. We have kept one CPC here. So in just like before, which we did, I did my CPC, and exactly like this, we'll keep, I think, 3 cases of endo and 3 cases of repro to discuss the whole of the block. And we'll put some MCQ questions, some of the SAQ question, so that your knowledge will be refreshed again, and you can ask question if you have a problem. And by that, we will finish our whole block on 27th of April. So there will be no class on Wednesday and Thursday. So you will be preparing yourself Thursday, Friday, Saturday, and Sunday, and Saturday, and then you will be coming on Sunday for 2nd of May for the EndoRepro exam. So this was all about the block, which was a little changed because of the the royal decree that we have to conduct exam before the Eid. So anybody wants to say anything, please kindly let me know. Yes.
Doctor,
Yes.
I just, after the MIF final, it will be on
Yes.
the 8th of May. We
Yes.
still have in the schedule, yeah, if you go to the next week, we still have MIF in the schedule.
Yeah. For example, if your examination is gone, so keep this thing as nothing is going on, because I have not touched these MIF or the fixed slot, right? We have,
Yeah.
I have not touched those fixed slot.
Yeah, so I was thinking that couldn't we take lectures or even finish earlier?
Even further, because I thought probably you have PBL here, then NTN lecture and pharmacology lecture, and if I put lectures here also, it will be very bombardment of the lectures. So I have kept little bit good for you, so so to have something to breathe, right? That's why I have not touched it. So if you see here,
but I was thinking,
I have taken out all the pro lectures. For example, you have pro sessions here and here, and I have taken out all the pro session and I have kept the lectures. And you know why I have completed your schedule and I have left 2 of the days, because I have reduced one of your PBL, number 1, And number two, I have all utilized all the pro sessions area and kept all my lectures there.
Yeah. I
And
just wanted to point it out, like maybe
yeah,
if we can finish
I
even
think
earlier, or if we can
you're
reduce
right.
from the Tuesday load.
So you want this lecture, for example, my lecture, this one, I can shift it here, right?
Yeah, either reduce from the Tuesday load or even bring from the last lectures, like even compress the schedule more and we finish earlier. So we have more like 3 days to prepare for the final.
For example, if you are getting time here in MIF, what's your name?
My name is Ward.
Worth. Whatever lectures we are giving to you, I think you need a time to go through those lectures. You are not here to only listen the lectures, but you have to go through those lectures and prepare for your examination, because now you have a little amount of time. So these MIF free spaces just consider as SDL, so that you can go and open your lectures and prepare for the exam.
Yeah.
Doctor,
Yes.
yeah, I think what Word is trying to say, instead of taking Tuesday 7 lectures,
Just hold on. Just hold on. Hello. How are you? Yeah, I'm in a class, and I'll call you back. Yes. Dear.
I think what Word is trying to say, Doctor, instead of having 7 lectures taken in one day, then there is no time to go through all of these 7 lectures. So what we can do, since we have 6 hours of extra MIF time, we can space them out. I mean, it's easier to go to.
So you want me to take this MIF out and put my lecture here. So you will have.
It will be easier to breathe through.
Okay, no problem. But I have to take permission from them. Honestly speaking, Worth, and I don't know who are you now. By 12 or 11:30 this morning, I have completed the whole schedule. Talking to all of the clinicians, because it's really very difficult to keep or to displace clinicians without their knowledge, because they have their own clinics in the hospital. So, Alhamdulillah, I have contacted with all of the clinicians and discuss their feasibility and put their lectures accordingly, so that they will not miss their clinics and they can give some time to you people. So regarding MIF, I'll try my level best to contact MIF people that yes, there is a final exam on Thursday. So probably we can use these MIF slot. For example, especially on Tuesday, my lecture can be shifted here. So let me talk to them. If it is like this, then I can shift my lecture. Okay.
Thank you,
Yes,
Doctor.
please. Thank you so much.
So anything else anybody wants to say? It's a really different scenario, my dear. All my brother and sisters, my son and daughters. So the situation is really different, as we were facing the situation now. As I was happy that your examination was on 23rd of May, and you were getting 3 weeks for your preparation. Now, the only good thing for you is, as you all are doing the same thing, after the end of the block on Sunday, you are having your exam. Just feel as if this is the same block as the other one. And all of them, please be on your toes, open your books, see your lectures, and prepare yourself for exam, so that you can celebrate your Eid like anything, right? You will enjoy your Eid. Otherwise, if your examination would be after your Eid, you would not have even enjoyed your Eid. Understand what I'm saying? So Alhamdulillah, I think this is a good thing for you, that we will complete our lecture, and that's the reason why I have given you full 2 days here. When it is Thursday, Friday, Saturday is also free, so you get 4 days to prepare your lecture for your exam, and on Sunday you will be having your Endorico exam. Hopefully, inshallah, I tried my level best to keep the best for you. And as one of the students said about MIF, so I'll see if I can do that. I'll have to talk to them first. I'm sure that there will be no other lectures of MIF after the final exam, and I'll shift one of my lecture here. Okay.
Doctor, is it
Yes.
possible to make the exam at night instead of morning?
This is not my domain, dear. This is assessment office, you can call them, because this is what I have been given, that this is the timetable. So if they wanted to keep it in the night, I have no problem. I have no problem. But the thing is, this is what we have received the schedule, and I have shared it with you people. Okay, because this setting of the exam is not my domain. It is assessment office problem, and this is what they have told me, that your examination will be from 8 to 12. So I have fixed this slot for you. So I hope everything is okay now. No problem. Okay, so thank you very much. So after this lecture, I think Dr. Atif is going to discuss about the review of the anatomy online. Kindly attend that lecture, so that I'll be discussing the pathology of the female genital tract tomorrow at 3 to 4. Thank you very much. Best of luck.
Thank you, Doctor.
Thank you.